Hello, and welcome to our webinar, USAID WASH Projects and COVID-19. This webinar is part of the University of North Carolina's Water Institute's Health and Water Conference, which we are putting together on invitation. My name is Paul Faith, and I'm a principal with the Cadmus Group. We are an employee-owned environmental consultancy working on water, climate, energy, health, and security issues. We are joined in putting together this webinar by Management Systems International, a Tetra Tech company. I'd like to recognize my colleagues Mike Minkoff at Cadmus and Cara Fraser-Perlman and Greg Rappaport at MSI for helping us put this together. The impetus for this webinar is a guidance document put out by WHO this past summer entitled Water, Sanitation, Hygiene, and Waste Management for SARS-CoV-2, the virus that causes COVID-19. This report provides guidance for WASH programs, updating previous guidance, and how COVID and WASH combine, and recommendations for how to manage that. Our purpose in putting together this webinar is to summarize the findings of that paper and to discuss the recommendations and what they mean in practice with panelists from the CDC, one of whom our panelist is was a contributor to the paper, USAID, which funds WASH projects around the world, and two practitioners from CARE and Tetra Tech ARD, who actually manage water projects in Tanzania and in Madagascar. We're going to start with brief introductions of everyone and then have a summary of the WHO guidance. After that, I'll get the conversation going with an initial question and with follow-up questions to make sure that we stay within our time, but also cover the topics that we've all agreed are most important. So starting with the introductions, I'll turn it over to Matt from CDC. Matt?
Thank you, Paul. I'm Matt Arduino. I am the Senior Advisor for Environmental Hygiene and Infection Prevention in the Division of Healthcare Quality Promotion. And I've been on the COVID-19 Healthcare Infection Control Team in the response at CDC since February. I am a public health microbiologist and an infection preventionist by training at CDC. And I have been a reviewer and a collaborator in the development of the WHO guidance that was originally published in March of 2020, and then updated in July of 2020. And this is the document we are discussing today.
Great, thanks. Nicole from USAID.
Hi, I'm Nicole Van Abel, and I'm the acting team lead for the Infrastructure, Natural, and Water Resources Management team in the Office of Technical Program Quality in the newly formed Bureau for Humanitarian Assistance at USAID.
Great, thanks, Nicole. Avo from CARE.
Hello, I am Avo. I am the Deputy Chief of Party of the RANWASH project here in Madagascar. RANWASH is a project funded by the USAID, implemented by a consortium led by CARE International, Catholic Relief Services, WaterEd, and two local private sectors, Sandandrano and Bushproof. The project aims to increase the access to WASH services, to improve health, nutrition, and to preserve environment. The project adopts a system approach, so we are working with all the WASH actors here in Madagascar, especially the Ministry of Water, Sanitation, and Hygiene, to strengthen the WASH system. We are providing technical, financial, material support to the ministry in charge of WASH to enhance the governance of the WASH sector, policy, planification, monitoring, coordination, financing, accountability mechanism. And the project is working in 250 rural communes to improve the access to WASH services, to engage private actors to invest and to provide the wash services and to promote behavior change. Thank you.
Thanks, Avo. And finally, Leif from Tetra Tech ARD.
Yeah, thank you. My name's Leif Kinberg. I'm the Deputy Chief of Party on the USAID-funded Water Resources Integration Development Initiative, which is focused on sustainable water and sanitation services here in Tanzania. What WARIDI has been working on is specifically related to water and sanitation access. Over the last 5 years, we've provided over 5 million in grants, most of that going to local NGOs to address inadequate sanitation and improve access to basic water services, as well as influence behavioral change related to sanitation and hygiene. We've also invested over 20 million directly into construction of water systems for rural and urban areas, and broader water resources management to ensure sustainable supply of water under a significantly increasing demand scenario with exponential population growth, as well as increasing climate variability. Thank you.
Great.
It's great to be on the panel.
Thank you very much, Leif. And now we're going to turn it over to Matt to give us a summary of the paper.
Thank you, Paul. So just to give you a little summary about the guidance document. So the guidance document is divided basically into two components with an introduction. And the introduction is a kind of a background section of what we know about SARS-CoV-2 and other coronaviruses, and what we know about that relationship and what we know about the outbreak. And then we talk about WASH in healthcare, and then WASH in the homes and community as it relates to COVID-19. And the key points that we talk about here in this guidance document are access to clean water, sanitation, hand hygiene and frequent hand hygiene, handling of medical waste and the appropriate handling of medical waste, and management of the dead or dead bodies are key. And we talk about things like appropriate PPE and the use of appropriate PPE, the use of soap and water for hand hygiene, and the appropriate use of wastewater treatment, and then disinfection of drinking water. So those are the sorts of things that we cover in the document as a whole. Okay. Can't hear you, Paul.
Thank you. Thanks, Matt. So what I'd like to do now is ask Leif, Avo, and Nicole for reactions. We've shared the paper with them, and what I'd like to ask you is, what you found particularly useful in the paper and how it may have influenced anything that you're doing on the ground.
Sure. Yeah, good question. Let me first share, Paul, a little bit about the context and current status of conditions here in Tanzania, and also a few photos of that'll give viewers a context as well. Levels of access to improved water sources varies across the country. 87% of people in urban areas have access, while only 48% in rural areas have access. Hand washing, access to proper hand washing facilities is still at about 50% for rural and 72% for urban populations. So that's, with that general context in mind, I found the WHO guidance very useful. It importantly mentions water disinfection and wastewater treatment. For us, we've focused for the last 5 years on improving the management of chlorination in rural small-scale water systems, which includes training to community-based water supply organizations, improving the regularity and effectiveness of water quality testing, and educating water consumers on the importance of water collection and storage, such as covering jerry cans for sanitation. We are also working directly on sanitation in collaboration with the Ministry of Health through the National Sanitation Campaign. And this focuses on improving household latrines, driving behavioral change around use of soap and water, and reducing open defecation across 20 local government authorities to prevent communicable diseases here in Tanzania. I think on the guidance, it's, as I mentioned, I think it's very useful. It needs to be disseminated more broadly for here, certainly here in Tanzania, for its lessons and implications to be taken up by multiple stakeholders. I found particularly useful, and I think here in Tanzania, it's very relevant, the ranking of effectiveness of water and soap alcohol-based hand rubs for sanitation, followed by ash and just water alone. This needs to be really shared with people along with behavioral change messages. There's a lot of, as I think many of us experience in this sector, there's a lot of inconsistent messaging on when and what represents effective hand washing. With that, let me just conclude by saying the guidance also aligns with, I think, much of what Tanzania has for health guidelines. So that's really positive, and specifically on frequent and correct hand hygiene, with only 48% of rural Tanzanians having access to improved water sources. There's a significant opportunity there to expand water access, and the messaging that goes along with this guidance is very important. On Waridi, we're going to, by the end of the project early next year, we'll provide 520,000 Tanzanians with access to basic drinking water services. Thanks. Back over to you.
Great. Avo?
Thank you. Yes, sure, it is useful. Such guidelines are very useful for WASH actors, especially here in Madagascar. One of the issue of the sector here is coordination. However, the pandemic activated the initiative of WASH actors to better coordinate intervention, to increase the financing of the sector. So such guidelines helps actors to harmonize activities, to develop tools to activate the development of tools to be used in the field. Just to share what are the activities implemented by the RunWash project and how these guidelines help us to accelerate the activities in the field. RunWash is working with different stakeholders in the field, especially private operators. We are working with small private operators to produce sanitary pads during the normal time. And during the pandemic, these seamstresses are reinforced to produce masks. There are some water operators managing water system as well. And to treat water, they produces chlorine. So all the elements in the guidelines are very relevant for all of these actors. We have adapted the messages within these guidelines to fit with the needs of different stakeholders in the field. But it is helpful to harmonize and to have the same messages disseminated in the field. Thank you.
Great. Thank you. And Nicole?
Like the other panelists, we did find this information extremely useful and important for us, especially in the beginning when we were answering lots of questions on how this virus was transmitted, including by the fecal-oral pathway when there was confusion about that pathway. So summary documents like this were really helpful for us for distilling down information and making it clear for us. As some of you may know who are listening, BHA is the Bureau of Humanitarian Assistance at USAID is the combination of two offices, the former Food for Peace office and the former Office of U.S. Foreign Disaster Assistance. I come from the former Food for Peace office, and our work is predominantly focused in rural areas with the most vulnerable populations in the lowest wealth quintiles, with my work covering sub-Saharan Africa and Asia. So the emphasis of this document in the section on homes and communities was most important to us, because we got a lot of questions on the messaging about transmission and hand hygiene. The question of soap versus ash has come up. And like in Tanzania, access to water is very low in many of the areas that we work. So we had a lot of discussions on improving access or maintaining continuity of service was important, since that's a key aspect of the hand hygiene component of all of this work. So we did find this document very useful for our work.
So Nicole, what has USAID done differently since, if anything, since the pandemic has begun?
When the pandemic happened, we were given COVID supplemental funding by Congress. So we did program extra money that was short term to respond to immediate emergency response type measures. And that some of that money was programmed through the Bureau of Humanitarian Assistance. But another thing that we did was we allowed our programs to adaptively manage. We have multi-year programs that were in the middle of their program cycles, and they needed to be able to change. So we had lots of questions and discussions with programs to adapt their programming, adjust their programming. Many of them were on a pause, and how to figure things out. And documents like this help them to understand how to message about COVID transmission, because knowledge was one of the key things that they needed to share with their communities, especially in countries like Bangladesh, where they had many cases early on. So we allowed them to pivot and change, and we drafted guidance for how to do that and to answer questions about that.
Great, thanks. So Matt, Nicole mentioned the fecal oral pathway, and I was wondering if you would comment about, what's known, if anything, about managing waste, and also assuming we're talking about WASH. So if people are practicing good hygiene, is there anything else that they should be doing, or will that pretty much manage to help people from getting COVID?
So what we know with SARS-CoV-2 is we do know PCR-wise that lots of virus looks like it's shed in the stool. Very few studies have actually recovered live virus in the stool, though a lot of people have attempted it. And what we do know is what is actually recovered in wastewater or in sewage appears to be inactive or not viable, or doesn't really be it appears to be non-infectious at this point. Though there are still studies that are looking at that. So from what we know right now, it does not appear that it does not appear to be infectious at this point. So wastewater, sewage does not appear to be infectious. So there's still lots of research looking at that right now. And right now, there's a lot of studies, and a lot of countries are going to wastewater as a surveillance tool, where they're doing PCR to look at detection of virus in wastewater to measure what's happening in the community. Because you tend to detect it in wastewater before you detect what's happening in the community. So it's a early warning signal that you have cases in the community.
Great.
Of SARS. So there is a small group of people who say it might be like SARS-CoV-1, because there is the incident at Amoy Gardens where there may have been some fecal aerosol component, that there might be something similar with SARS-CoV-2.
Right. Okay.
Do we know that for sure? We don't know.
So if people are practicing good hygiene, hand washing, using latrines or other things to isolate feces, will that pretty much protect people?
If they're using good practices, good hygiene, if they actually are in the industry and you're wearing appropriate PPE, you should be fairly well protected, yes.
Okay, great. Now, Leif, you mentioned in your comment that that you'd like to see that you found the paper valuable and you'd like to see the information get out. I'm wondering for you and for others, when something out of the ordinary happens, where do you go for information? How do you find the information that you need? And for Nicole and for Matt, how do you push information out? What I'm interested in is, how is that gap between practitioners on the one side and researchers and development agencies who may have the information and are a kind of a bridge to disseminate that information. How does that connection get made is what I'm particularly interested in. So any comments from anybody?
Well, Paul, I can start off. There's a lot of information. There was a lot of information about COVID, and some of it is certainly superior to others, as we all, I think, experienced as this was emerging. What we did early on was identify and adopt some of the practices that were recommended or considered most effective by WHO and CDC, as well as the guidance we were getting from USAID as a USAID implementing partner. Early on in the pandemic, we worked to regularly communicate with our staff, our partners, and the general public about the importance of three main practices. One is hand washing with soap, the second is physical distancing, and the third being wearing masks. Rather than regularly revising our internal guidance as a program, we focused on refining and really reinforcing those three messages as regularly as possible and working with communities to help them make that transition as well and better protect from infection and transmission of COVID.
Yeah. Okay, great. Anyone else?
Yeah. So what we do is we actually look at the science, and as things become available, either guidance gets updated, and that appears on the web, our web, or we develop new facts, which also get posted on the web, and some of it actually goes out as a partner call, where it's a webinar that's given that goes out to partners. It gets announced, and there will be a presentation that goes out. The other thing that happens is that there's actually ongoing research. We've just had an FOA that went out to academic partners. I think it was back in July. So we funded a bunch of research projects. So for FY20 and FY21, there are a number of research projects that are out there to answer where we thought there are a bunch of data gaps. So some of that is on the wastewater side. Some of that has to do with other surveillance types of issues. Some of that has to do with nursing homes. Some of that has to do with COVID and HVAC systems. So there are all sorts of other sort of research projects that are going on that are being funded. And that's only in the United States. I mean, there's also other research that are happening in Europe and other places. So as that science matures, there will be other, and that's just our agency. There's the science foundations in other countries that are funding research. As that science becomes more science that becomes available, we'll learn more things, and that will inform guidance as it goes on, and things that we'll learn, and then things will get updated and published and out in the, the peer-reviewed world, and things pushed forward.
Great, thanks. Avo or Nicole, any comments from you all?
Yeah, we mostly used WHO and CDC in the beginning, and we also used some clearinghouses of information, like the Global Wash Cluster collects information that is useful to us. Also, the London School Hygiene Hub was another thing that we looked at quite regularly, because we drafted our own guidance for the ability of our development programs to pivot. So we tried to rely on resources that already existed and not rewrite anything. So we focused on these clearinghouses. And another thing was you talked about linking practitioners to researchers. And one of the things we have in the Bureau for Humanitarian Assistance is an associate award called Pro-WASH that is run through Save the Children. And it's a 5-year associate award to support our Food for Peace programs in capacity building, specifically in WASH. And because COVID was so centered around WASH solutions, they were being contacted a lot to answer questions as well. But instead of like adding another clearinghouse to the universe, they did some other things. And one neat thing that they did was they actually linked the London School Hygiene Hub researchers to our practitioners in the field to host a small group discussion. So there was only like 10 participants from the partners who got to directly interface with the researchers and ask questions specific to their country context. And it was very successful. And so I just heard yesterday that they're probably going to do another one. But it was facilitated by the Pro-WASH director. And but it just created a nice link for the people in the field to actually be able to ask them like how to solve problems in real time. And they know they are the researchers, so they could answer questions. They gave some presentations, and it worked really well.
Terrific. Avo, it looked like you wanted to say something a moment ago.
Yeah, thank you. Just in addition to all of these guidelines, I think that the pandemic in Madagascar, as I already said, activated the coordination, the exchanges between the actors here. So we have had a weekly meeting of all the WASH actors here to share information, to share tools, and it is very helpful for all the organization as well.
We're having trouble with your feed, Avo. Okay, keep going.
And as RunWash is a project implemented by a consortium, each organization as well has some resources, some documents to help the implementation of the projects in the field. And we have also used all of these tools to be adapted to the context of Madagascar.
Great. So I have a follow-up for Avo and Leif. So you have an opportunity now to tell USAID and Matt what you might like to see. So from a practitioner and implementation point of view, with regard to information on topics like these, what would you like to, what sort of support or other information what would you like to see from USAID and CDC if you could ask that you're not getting now?
Well, I actually think that, during the pandemic, it was pretty effective. We were all adapting and receiving the sources of information from WHO and CDC. And, regular meetings were really important to us here in Tanzania as well. I think, and we may talk about this later as well a little bit more, but I think some of this, going back to Nicole's point about who we're working with, we're really working with communities and households on sanitation and hygiene and water supply. And so, getting information down to those levels that's digestible from, starting with the research and then bringing it down is very important to the work we do. As a WASH project, we were doing a lot of this already in terms of the behavioral change and the sensitization around sanitation and hygiene particularly. Overall, I think, everyone was adapting and trying to move forward with an evolving landscape, I think, and also trying to synthesize the pretty rapid volume of information that was coming out. But overall, I think it worked pretty well in terms of being able to adapt programming here in the field.
Okay, great. Avo, do you have a comment on that? If not,
Yeah,
it's okay.
I just want to add about the support to private sector. I think that we have got a lot of information points to support activities in the field, but some support, some kind of example of support to private operators to really be resources to support the sector. I think that it is useful to get more examples from other countries how they could support the private operator to increase the access to wash services. And the second point I want to add is about wash system strengthening. Here in Madagascar, we always tried to reinforce, to strengthen the wash system during the period of the pandemic. But it is like another system. It is not really integrated in the wash system in a normal time. How to adapt, to capitalize all the good practices during this pandemic. We could really activate, we could really be more responsive during the pandemic, but how to adapt it in the new normal. So just, I don't know if I was clear enough, but just to think about the wash system strengthening during the and to adapt it in a normal life.
Right. So I want to turn the question. Thank you, Avo. To turn the question around, Nicole and Matt, for people who are practitioners in the field, what would you like to hear from them? What avenues of communication might be available, to help coordinate a response and to learn about the information that they are seeking?
It might be just to learn to understand what their needs are. Because here I am. Most of my recommendations are made for here in the United States. The resources that you have are different. And so usually when I'm writing guidelines and recommendations, I'm writing for the United States. It would be, so I don't know, what you have available, in the country that you're working in. So if I have some understanding of what you have that you're working with and how I can adapt my recommendations to fit your setting, that would be helpful to me. Because, you may not have the types of disinfectants that I have available here. So my recommendation here is use an EPA registered disinfectant with this label claim. You don't have that. You have chlorine, but you may not have bleach. You may have, something else, or you may have calcium hypochlorite, or you may have something else. I don't know what you have in your armamentarium to use. So sometimes I need to know what you have available to you so that I can then tailor something. Oh, in this setting, consider using this.
Yes. Nicole, you were nodding your head on that. You have a comment?
We also would like to know what is happening on the ground. We work in so many different countries and we don't know all of the context. I mean, some countries in Asia were getting hit really quickly and fast, while countries in Africa didn't seem to get hit, especially in areas where we worked because they're very remote and isolated. So understanding the on the ground situation has been very important for us, because we know that solutions are context specific. So we're trying to engage with partners in that way. And luckily in the Bureau for Humanitarian Assistance, we have a pretty good linkage to our partners. They can go through the Associate Award Pro Wash or directly through our awards to reach out to us to have discussions for WASH staff in our technical office to WASH staff in the field. I think I would also like to know about challenges and successes that they have had with different things, because we are making a rapid fire of recommendations, but what is working for them? I know in the beginning we heard that the social distancing measures just wasn't going to work in some contexts. I mean, a refugee camp, for example,
Right.
Cox's Bazaar, that just wasn't a reality for them. And we haven't heard, I haven't heard specifically like what the outcome of that is. So I do know that our Pro Wash Award has engaged with a few countries, including DRC, Burkina Faso, and Malawi, on lessons learned and how they have pivoted their development programs, their longer term programs, to adapt to the scenario. And they plan to release some learning notes on that in the near future. And I think things like that are going to be valuable to us for, we don't want to like drown everyone in a bunch of guidance and adapting it all the time, but being able to keep the communication channels open is going to be really important for us, I think.
Yeah, great. Thank you very much. Avo, you briefly mentioned a point about strengthening behavior. My question for the group is, does an event like this, or do you expect an event like this to actually strengthen the norms of people's behavior around WASH? We do know that a lot of people don't wash their hands, very regularly, for example. There are still some people who may prefer open defecation to the use of a latrine. So I'm wondering, in a practical sense, have you been seeing, and do you expect to see it continue? If so, good hygiene practices because of COVID? Anybody? Any thoughts?
I think that
Avo, you're on mute. There you go. Seem to have lost feed.
Paul, maybe I can.
Yeah,
there we go.
Say that
I think that
Avo, we'll have to come back to you. We're having trouble with your feed. Leaf?
Can you hear me? Can you hear me?
No, we can hear you now. But now you're on mute. So Avo, I'll come back to you in a moment. Leaf, you were going to add something?
Hear me?
Yeah, maybe I to add to just my perspective, our perspective, perhaps here in Tanzania, on your question in regard to significant changes. I absolutely. I mean, in front of every school, and almost I shouldn't probably say every, but most schools, most churches, most businesses, most government buildings, most houses, there is there's buckets with soap set up. People are paying much more attention to hand washing. It's significantly changed how people treat, particularly hand hygiene here in Tanzania. I think the risk and opportunity, I guess, that we have right now is to not lose that momentum. There's clearly an opportunity to continue on that positive behavioral change. But as the context changes around COVID, and people get a little bit fatigued and a little bit moving back to their normal patterns, it's very likely to slip back. And so I think it's incumbent on us to really continue pushing those messages on the importance of hand hygiene to protect people against preventable diseases that can be addressed through that.
Right. Avo, I think we have you back now. If you want to try to respond, you were
Can you hear
going to
me
earlier.
now?
Yes.
Yeah. I think that it is the same in Madagascar. Behavior change is really visible during the time of the pandemic here in Madagascar, especially schools, health centers. There is a big change of the practice of these behaviors, especially hand washing with soap, respect of distancing between people. There are many tools disseminated in many places, especially in public transport areas as well. So it pushes people to adopt the behavior. And I think that there is also an opportunity at the private sector side. They consider the pandemic as an opportunity to diversify their product. As I said before, the water operator, it just produce chlorine to treat water because they are providing water services in the commune. Now they use the chlorine as a disinfection product as well for schools, for health center, for public transport. So there is an opportunity seized during the period from many actors, not only from development actors, WASH actors, projects, but also from private sector, from public institutions such as school and health center. I think that the risk is especially the availability of services. There are many actors now supporting the movement, if I can say like this, but we need that this support continue, especially in remote areas where services are not really available, but there are many efforts during the pandemic to make it available.
Nicole, did you want to look like you wanted to add here?
Gonna say that it's great that it seems from the programs that hand washing is improving and all of these things. We've seen that as well in Ebola. It was the same thing was observed, that hand washing was increased due to the outbreak. We know that the sustainability of hand washing as a behavior change activity is tenuous at best. So it would be really great to see follow up on this, that if there are increases now, are they sustained? Because hand washing is like one of the hardest things to move the needle on in most of our programs. So I'm hoping that somebody's gathering some information about lessons learned and how it worked and just the sustainability of this practice, because I mean, we're getting fatigued here. So what is happening everywhere?
Right, right. Matt, you were telling me the other day, I'd like to mention this, that the effectiveness of hand washing in dealing with COVID and the characteristics of COVID that make that a very good response. That it's
soap is very effective against an envelope virus. As a matter of fact, just the sodium lauryl sulfate, which is even in shampoo, is enough to inactivate the virus. So just hand washing with soap and water is effective. So it's a good measure. Not everybody needs to go out and get an alcohol hand gel. We use alcohol hand gels in healthcare is because try to get healthcare workers to go wash their hands for however long it is. That's why hand washing compliance was terrible.
Right.
So many years ago. And now it's getting better with alcohol hand gels, with that use. And so that's why in healthcare, it's all about, use of hand gel in healthcare facilities to improve hand hygiene in healthcare facilities.
Now, several times ash and water has come up, and I'm wondering if that's something that you could mention, because we've just touched on that, but the effectiveness of ash and water, if you could speak to that for.
So ash, all I can think right there is it's called friction and water to remove stuff off so that's to remove gross contamination off your hands. It's not antimicrobial. It's to help remove organic material off the hands. Is it as effective as soap? Probably not, because soap contains other things to get some of the organic material off your hands, because it has detergents which kind of lift stuff and encourage stuff to come off the hands. But it's like using sandpaper. So using something just to get material off your hands, along with water to wash it off. But it's not an antimicrobial agent. Soap has some limited antimicrobial properties, So there are studies that show you can get a lot like, I'm not sure, are there any studies that show what log removal or log reduction you get with the use of ash, but at least with soap, there have been studies that show, maybe depending on how well you wash your hands, you can get a 2 to 3 log reduction of microbes off your hands, with just a good hand wash.
So in a pinch, if you have nothing else, ash could be effective.
Ash will remove material off your hands.
Right. Okay.
Well, how what that yeah, I don't know.
Right. So
Paul,
yeah,
can I go back and just follow up on Avo's comment about private sector? One of the things that was really interesting here in Tanzania is, as the pandemic kind of emerged and disrupted things, what we saw was pretty significant disruptions in international supply chains, and the private sector in Tanzania, I would say mostly in Tanzania, it might have been in the region of East Africa, but there was a fairly rapid response and scale up of things like that were disrupted in the international supply chain, such as hand sanitizer. Businesses really stepped in and started producing those consumer products that were needed very quickly. I was surprised at how quickly, actually. Maybe further research should go into how effective they were. It was, for example, the alcohol content in sanitizers, as is recommended in this guidance. But I also think there's opportunities that we saw emerge for private sector in hand washing stations. And boy, there was such a variation in the quality and probably the real COVID transmission prevention capability of different hand washing stations, all the way from just putting a tap in a bucket to foot pedal, well-designed, well-manufactured systems. And I think so it was really great to see that private sector response pretty organically here in Tanzania that emerged as a result. I just wanted to add that.
That's great. Leif, as a follow-up, you said that there is this great difference from hands in a bucket, which doesn't sound like a very good practice to me, to well-engineered systems. How do those people get information about what is effective?
Well, I would say that certainly the quality of the information varied greatly. I think one of the things that I saw here was there's a need for consistent messaging across different levels. I mean, a largely rural population that is dependent upon getting information from a few sources, possibly WhatsApp, certainly their communal connections, community connections, and there was a lot of variance between different levels of government in terms of the type of information and the guidance that was coming out. I think it's a real challenge actually in terms of how they can effectively receive information. It's got to be decentralized, clearly, working with local government, community health workers, and others. Those are probably some of the main sources, but also, for those who can afford it and have them, smartphones are obviously a major source of information.
Yeah. I wonder, Avo and Nicole, have any comments on that? And several times, some of these very sophisticated, the research being done by groups like CDC, the WHO putting out this, this very helpful guidance, but getting that information to the people who actually are the ones, setting up hand washing stations or or the ones who need to be washing their hands more regularly, et cetera. How does that connection in your experience get made?
I mean, for us, that was a lot of the conversations we were having in the beginning was how to get the messages out. I mean, when we're working with people who are multi-hour walks from a road, how do you get that information? There is no cell phone coverage. Some places did cell phone coverage and radio messaging, but they did have to rely on staff physically going places if they could in the safest manner possible to share the information because they just didn't think that it was getting out there, and they needed to explain about that, how important hand washing was, wearing masks and being distanced from your neighbor. People didn't know the basics of COVID transmission in a lot of these places, and they wanted to get that message out, but it was mostly not high tech. If they could, they tried, but overall, the partners just didn't do that. So they had a variety of different ways that they did it. And as far as hand washing stations, they did increase them for us. We do food distribution. So they added them in more public spaces for people to be able to use as well.
Okay. Avo?
Just to add, the case here in Madagascar, we have noticed during the pandemic that the Ministry of Water, Sanitation and Hygiene here in Madagascar becomes, the leadership of the ministry becomes stronger. We have 22 regions here in Madagascar, and within the platform, the WASH cluster, as I said, with the weekly meetings, all the regional directorates have participated in the weekly meeting, and with the sharing of tools, information, they try to mobilize all their partners in the field to disseminate the messages. Phone coverage here in Madagascar is not very. Even there is connection, people do not really have access to mobile phone, so it is not really a channel used to share messages. We use especially radios, posters, so more face-to-face communication, which is more difficult during the time of the COVID. So we tried to change the communication strategies to avoid, to promote distanciation and to protect even the staff of the project. But as I said, as all actors are really mobilized, try to be really responsive during the period of the pandemic. There is coordination, there is really activities in each region. It is not really the same during before the COVID, because there are some regions where there are many actors there. There are some regions where a few WASH projects work there. So for the moment, it is okay with the fund, COVID fund from different sources, but it is not really so it is a risk for the future.
Great. We're coming up to time, and what I'd like to do is give an opportunity for everyone if there's a point that you'd like to make that's burning that you haven't had a chance to make, if there's a question that I haven't asked that you'd like to provide any additional information. I'd just like to give, if there's any other point, any other observation that anyone would like to make, to give you a chance to to provide anything else that might have been missing from our conversation.
I would just remind people that, as this response goes on, the science is evolving, and that as learn more, recommendations may change.
Yeah.
And just this we're going to learn more as we go on, and just be aware that there changes may be coming. Do I think our recommendations will change greatly? I don't think so. But as we learn more with the science, just be aware. We may learn new things.
Great point. Great point. Anybody else?
Well, Paul, maybe I'll just say that I think we need to look closely at high-risk populations, and particularly those that don't have adaptive capacity to really respond to pandemics, such as savings and livelihoods that they can get through, such as subsistence agricultural livelihoods that are really dependent upon sales at local markets and things like that. I think those populations particularly don't have the disposable income to address things like treated water and soap, and so we're really going to have to think through how to reach those people and help them through behavioral change messaging on putting more investment in those important health decisions, I guess, around emerging pandemics like this. So hopefully we can make further investment in that area.
All right. Thanks. Great point, Leif. Avo or Nicole, any closing comments?
Yeah, just building off of that, what we see, I mean, with the Bureau for Humanitarian Assistance, we have a program called FuseNet that predicts how many people are going to be hit by food insecurity due to the economic livelihoods getting interrupted. And that, I was just thinking, that's definitely going to impact WASH, because right now they may have access to water or soap, but if the economic climate stays the same for them, are they going to prioritize these purchases in the future? It's hard to say. I mean, they need to be able to buy food. So we see that a lot in WASH under normal circumstances. And now this has been interrupted. And with many of the countries we work in, we don't know when they're going to open, the markets are going to open. So it's just a really difficult time. And there's a lot of other factors besides like the changing information on WASH. It's like the whole ground is shifting. So we have to think about like the whole picture.
Great. Thank you. Avo, you have a last remark for us?
What I just want to highlight to conclude is the consideration of gender and social inclusion. As Matthew said, we are going to get more recommendation as the situation evolves. We are going to have more lesson learned and so on. So I think that the consideration of all different categories of people, especially women, girls, disabled people, and during the COVID crisis as well, old people. So to get more tips, to get more recommendation, how to consider more these people to be sure that no one is left behind. Everybody have access to wash services. Thank you.
I would just like to close by thanking you, Avo, Nicole, Leaf, and Matthew for Cadmus and MSI. We really appreciate your participation. I think this has been a great webinar, and look forward to the opportunity to connect with you all in the future. Thanks, everyone, and we hope that you found this webinar of value. Goodbye.
Thank you.
Thank you.
Thanks.